Hello, my name is Dr. Shah, and I'm the founding attorney of the Doctor Lawyer Law Group. We're a boutique law firm dedicated to the victims of medical malpractice and personal injury. Now, one of the areas that our firm focuses on is birth-related and pregnancy-related injury. And today I want to speak about one of the most ominous forms of birth-related injury, and that is hypoxic ischemic encephalopathy. So let's break those words down. Ischemia is insufficient blood supply to tissue. So if that happens in a heart, that results in a heart attack. Well, in a baby as it's coming through the birth canal, if for a number of reasons the blood supply to the brain of the baby is compromised, that ischemia over time will result in permanent injury. That we call encephalopathy. So the most common cause of long-standing encephalopathy is hypoxic ischemic encephalopathy. And hypoxia refers to the fact that as a result of cutting off the blood supply to the brain, that you also shut down the oxygen. So what are some of the conditions that can result in a hypoxic ischemic encephalopathy? In other words, insufficient oxygenation to the brain resulting in permanent injury. Well, one of them is when the baby actually becomes asphyxiated by the umbilical cord. In other words, the cord wraps around the neck of the baby, resulting in compromised blood flow to the brain, and that can result in permanent brain injury. Another is a failure to perform a C-section at the right time. One of the things that we expect from a competent medical provider is the ability to know when it's appropriate to quickly order a C-section as opposed to a vaginal delivery. Another condition that can go on to cause hypoxic ischemic encephalopathy is diabetes in the mom. Also, if mom's been diagnosed with preeclampsia or just high blood pressure, that can also be a risk factor for the development of this sort of encephalopathy. Incorrect use of forceps during the delivery of a baby, prolonged labor itself, placenta abruptia, or shoulder dystocia are some of the other more commonly recognized causes of ischemic injury encephalopathy to the brain. Now, what can occur as a result of sustained impairment of oxygenation to the brain of the baby? Well, cerebral palsy is one of the most dreaded conditions that can cause a host of musculoskeletal problems that can result in paralysis, weakened muscles, and can require lifelong treatment. But more subtly, ischemia that results in hypoxia or lack of oxygenation in the brain can result in mood and personality disorders or more global traumatic brain injury. It can result in a lowered IQ. It can also result in epilepsy or seizure disorder in the baby, and it can also result in reduced motor function. If you or a loved one has undergone a delivery in which you suspect that baby might have suffered from ischemia or insufficient blood supply, and as a result of that has suffered brain injury, then you owe yourself a consultation with a Doctor Lawyer Law Group.